Greetings, everyone. I am Ngabuto Nicholas Mabena. It's Thursday, the 25th of September 2025. We have a health crisis amongst the migrant community in South Africa. I must say that we did not pay attention to this question. We concentrated on the documentation of migrants to ensure that migrants are legally documented in South Africa. Either they have permits or asylum documents and any other document that will make them legal. We did not really pay attention to the health question affecting migrant communities because over the years, people have not been having problems to access health facilities. Of course, there are two groups or three groups of migrants. There are those that are rich. Those ones have no problem because they go to private doctors, private clinics. They have their medical aid, followed by the middle class. They also do not struggle. They can easily consult a private doctor. But there are those on the low end of the ladder or the social ladder. These are greatly affected. In the last 3 days, we circulated a message in our WhatsApp chat groups, that is in community WhatsApp chat groups, just to do a survey on how many people have been affected, focusing those that are on chronic medication. We never knew that there are so many migrants that need this medication for various alignments or illnesses or chronic conditions. Some, in terms of the reports that they keep on sending to us, is that they've defaulted and that this is a crisis. Of course, we cannot reveal the identities of these because they are sharing their information with us in confidence as we are looking for a way out to assist. If a person defaults on someone who's living with HIV, someone who's BP, and the other conditions, it's a health risk. Some were saying for the last 3 months they haven't taken their tablets or medication. What we have noted, given what also happened at Uval Clinic today, early today, is that it is not only Operation Tutula, it is communities. So you have community members that have taken it upon themselves to spend the whole working hours at a clinic, public clinic, to inspect the documents. If you do not have a South African ID, you do not access. Before we did this survey in the last 3 days, we thought maybe they are selected clinics. But you ask a person, you then realize that a number of public clinics are now a no-go area for migrant communities. I might say that the spirit of solidarity, Pan-Africanism, is now forgotten, is dying. we see the rise of narrow nationalism. One would have understood if there was a policy pronouncement giving people a deadline to say in the next 12 months, this is what is required for one to access a public clinic. But it was just a spontaneity. People cannot afford or cannot access these health facilities. People with BP, as I've already indicated. So it's a serious problem. If we are to help, which is where it is difficult as well, though we're trying our best, there are certain things that we have to meet or certain requirements that we have to meet. Because we cannot just go and procure chronic medication and start to distribute to people. That would be dangerous. So while we are trying to assist, I'm not a medical practitioner, so I can't go and procure medication and call people to our offices to say, come and pick up your medication. It cannot happen that way. You need to be a legal practitioner to do that. And the person who is receiving this medication must be seen by a nurse or a doctor. So we also understand the frustration that is there amongst our community. So some that are responding to this survey. They think that we will simply say, okay, you were denied to access your medication. You can come and pick it up with this side. Health issues do not work like that. Yes, we are talking to people that can assist because you cannot play around with issues of health. As I'm saying, we can't simply go and procure medication. And for you to procure medication, you must be licensed. That's why I'm saying there are certain requirements that one have to meet. Well, it's different from a person who does not suffer from any condition, but want to do a checkup after every 6 months or after 12 months. That is not a crisis. But I'm talking about people that either pick up their medication monthly or after 3 months, as people have been telling us. But for a person like myself, who will only want to go for a checkup when they fall ill, it's a different thing. Maybe just an emergency. Like a comrade who sent me a message that afternoon that in the morning was involved in an accident. Their tax overturned. He was not injured. So I was saying to him, you need to go and see a medical practitioner because you might be involved in a tax accident. You say, no, I'm okay. It's just a bruise. I remember I was involved in an accident myself on the freeway. I think some 2-3 years back. We were taken by an ambulance to the nearest hospital or clinic, which was a Hebrew clinic, just for checkup to make sure that you will not have a blood clot. because it's important that if you get involved in an accident, you see a medical practitioner. So it is these issues that an emergence might happen. But outside the emergence, quite a number of people, of course, are not affected. They are not worried. So this is where the challenge we have is with respect to those that are on chronic medication. So when we made an announcement that we would want to help set up the health medical fund, and we said do not want to do a scam. We want everything to be above board. We started doing research, and we then realized that yes, it's possible. It will happen, but it will not happen uh, in terms of the time frames that we have given ourselves, because there are a lot of requirements that have to be met. Like I'm saying, we're consulting stakeholders because you can't simple set up a fund and say, people, let's contribute, and then there is a fund you can then run to this area. You need to negotiate with the health practitioners. They've got their own terms as well, something which we are working on. Because we want a community thing where the migrant community benefits. Their issues of registrations, which of course we've registered. But there's another registration that is still outstanding, which we're working on. So we said before we start anything, we rather group people together. But before we even say, make a contribution to this fund, or we write to a donor and say, make a contribution to this fund, we need to ensure that our governance structure, it's a setup, it's okay. We need to have a board of trustees that will oversee the fund, because this is a fund. There are many scammers out there, and we don't want to be part of those scammers. We don't want to be part of those scammers. So that's why it's important that we meet all the requirements, so that when donor X put their money, it has to be clear that, okay, this is money to assist a pregnant woman. This person will deliver in this facility. And how will this person access these facilities? All these are important things that have to be dealt with. If this person is on chronic medication, which doctor is going to check up on their condition? So all these things are new to us, because, like I said, we never paid attention to this. Someone sent me a message, said, Mapena, this is a scam. If it is a scam, we would have said, look, let's set up a fund. We have asked people to make a financial contribution, but we can't do that. We cannot do that. We can only do so once we have a board of, once we have registered everything, including with the Department of Social Welfare. We have a board of trustees in place. We've agreed terms and conditions with the health practitioners to say, if someone is collecting a medication for BP every month, you'll be checking on them. We agree, and so forth and so forth. It is then that we should start to roll it out. But I was saying, the issue is Pan-Africanism is gone. Because you cannot, surely you cannot block health facilities. Children refuse the entry in a clinic. It's not only UVA, it's not only Hillbrow. Like I'm saying, in the last 3 days, we've been doing a survey. It's all off. Someone will say, I was in Tembisa, I was denied. I was in Cosmo, I was denied. I was in Soweto, in Durban, I was denied. In Cape Town, I went to this clinic, I was denied. Almost the majority of public health facilities. So that's a crisis. There's a child that died in Alexandra. I saw whether it's the MMC or MEC for healthy who said this must stop. That was just a political statement. It is not stopping because there are people stationed there permanently. Of course, we're not part of the people that called for a demonstration or people to visit a UVEL clinic. I heard the voice note circulating yesterday. In the morning, I saw the video by the UVEL councillor who recorded a video standing in front of UVEL. Unfortunately, I spent the whole day in Pretoria on other issues. Then I've seen later on the videos, and the councillor was also there. Police were called. People couldn't be admitted to access the clinic. I saw the MMC for Johannesburg City Council there. But the fact remains that the people have taken law into their own hands. And we have a health disaster looming. Why are we doing this to other Africans? Why are we doing this to ourselves? Why do we want other Africans who are victims of their own governments? Then they have to suffer in the hands of us, the working class. Why do we allow ourselves to do such? Because this is very sad. We saw the EFF opening a police case. We appreciate what they did. It's an attempt. But why will the police allow people to block others? That's a serious concern. We ran a campaign when Floyd in the United States was murdered by a white cop. We said Black Lives Matter or matter. But these are Black lives that we are stopping because they are not born in South Africa. In the case of Zimbabwe, and we want to underline this, that the problems that we have in Zimbabwe, if you ask any Zimbabwean, a progressive Zimbabwean for that matter, they will tell you that the reason why ZANU-PF is still in power has been protected by the African National Congress. Go back to 2008 when ZANU-PF lost elections. Then President Thabo Mbeki said there was no crisis. If the people of Zimbabwe decide to elect whoever they want to elect, it's their decision. Because this relationship, I know there are comrades from the African National Congress that watch my channel, and I want to make this point. How does the relationship of the ANC and the ZANU-PF assist the poor people who are flocking to South Africa? Because if the ANC has not been shielding ZANU-PF international forums like in SADC to ensure that ZANU-PF conducts elections in line with the SADC protocols of holding free and fair elections, ZANU-PF will not be in power. And if ZANU-PF is out of power, yes, we don't expect that the majority will go back to Zimbabwe. But this will lessen the burden on social services in South Africa. ZANU-PF now wants to amend the constitution. A lot of funny things are happening in Zimbabwe. This 2030 agenda. What will SADC say? Zimbabwe is a sovereign state. It has a right to do whatever it wants. It subverts the will of the people. And when it subverts the will of the people flock to South Africa. And we have this crisis. What does this say to the image of South Africa, particularly the African National Congress? Because we cannot blame poor people that are coming to South Africa. You cannot blame us and say, Mapena, go back and fight Mnangagwa. You can't put that blame on us. Because we all know that Mnangagwa is in power because he's supported by the military. We know what the military did in 2008 when ZANU-PF lost the power. We all know what the military did to the workers in January 2019 when they took to the streets. Just demonstrating not to remove a government for better working conditions and better wages. People were brutalized. We saw what the military did in 2018 August. The Halema Komonglande Commission was there. The report is there. Nothing was done. Nothing was done. So this is why we are saying Pan-Africanism is dead. Narrow nationalism is taking center stage. We respect the African National Congress as the oldest liberation movement in Africa, founded on Pan-Africanist values. And when the ANC was established in 1912, there were chiefs from Matabeleland that attended the founding conference of the ANC in 1912. ANC influenced a number of formation of liberation movements across Africa, including us in then Southern Rhodesia. This is why the first liberation movement was called the African National Congress in Zimbabwe, because of the influence. First, the ANC was seen as Pan-African. The Liberation Committee inside the OAU was Pan-African because it understood that colonialism or liberation of countries like Ghana, Tanzania, then Zambia alone in the 1960s was not complete. If you still had Rhodesia, you still had Mozambique, whatever it was called, Angola, whatever it was called in other countries, South Africa and apartheid. So the whole idea was that you cannot celebrate your liberation as a black person in Ghana when there's apartheid South Africa. But today, black people, poor people for that matter, are being denied to take their medication, which they've been receiving. These are people that pay taxes, but they have been refused. Yes, it's not a government policy, but the government is not doing enough to stop this illegality that is happening. It's not. We cannot then proclaim to be Pan-Africanist. We sympathize, not sympathize, we give solidarity to the people of Palestine who are under apartheid Israel. We give solidarity to all the oppressed people of the world, including Western Sahara and in many other countries. But if we are not careful, a health genocide, some people accuse me for exaggerating. But like I'm saying, we did not pay much attention to this. I was not even aware that so many people need medication on a monthly basis until we began to say, let us wait a minute, let's just ask what's happening. So we hope that the South African government will correct this so that people are not denied. The anger must go to the ruling party in Zimbabwe, not to the victims of the ruling party. President Ramaphosa was in Harare some few days ago at the Harare Agricultural Show. He spoke good things. Was told that the economy in Zimbabwe is recovering. I don't know whether he told President Mnangagwa to say, look, I hear what you're telling me, but I have a crisis. Because one would have expected President Ramaphosa to say, look, I have a crisis. My party got 40% in the last election. And one of the reasons is that we are not doing enough on the question of migration. And we are going to local government elections in 2026. And we have these movements that have sprouted in the name of driving migrants out. And they are targeting your own people, Zimbabweans. What are you doing to resolve your own problems so that you lessen the burden to me? But there was a Liberation Movement Party conference in Kempton Park some few weeks ago, and they spoke good things. I know I've taken long, but this is really, really a crisis. We have a health crisis amongst the migrant community. And this must end. And this requires a SADC summit to discuss the question of migration. Why do we have so many Zimbabweans in South Africa, people of low skill? There must be such a summit. Because this issue of putting the blame on the victims who find themselves in South Africa is not on. Thank you, comrades. Good night. If you are new in this platform, kindly subscribe. Otherwise, like in this video, circulate your contacts. Good night.